Hello, and thank you for attending today's respirator training for the Just-in-Time Elastomeric Training and Fit Testing Clinical Trial, known as Project JetFit. This is a study being conducted to determine if reusable respirator education and use is possible in healthcare during a disposable respirator supply shortage. Today's orientation and training is a CDC-sponsored study and does not necessarily mean that your health system will be using reusable respirators in the future. This video will include the steps on how to ensure proper fit and safe use of an elastomeric reusable respirator. The benefit of a reusable respirator is that you are able to keep it with you at all times and reuse it as needed. The elastomeric respirator you will learn about today consists of a flexible silicone facepiece, 2 removable air filters, and an exhalation valve. Today's video will guide you through the 6 competencies listed on your demonstration checklist instruction sheet, as well as provide a quick review of what to expect during fit testing. Before we learn how to confirm the fit and utilize your reusable elastomeric respirator, please take out your instruction sheet labeled EHMR Cohort Educational Handout and use it to follow along. At the end of this meeting, you will be evaluated on your ability to safely complete the 6 competencies that are listed on the instruction sheet and discussed in this video. The first competency you must learn is how to inspect your respirator. Before putting on a reusable elastomeric respirator, it is important to carefully inspect each part. If it appears damaged, do not use it. Start by inspecting the facepiece for debris, damage, or inflexibility. Examine the head straps for breaks, loss of elasticity, or twists. Next, remove the exhalation valve cover. Examine the cover and valve for damage or debris. Finally, untwist the filters to remove them. Next, remove the filter covers. Then inspect for damage or debris. Lastly, twist the filters back onto the inlet ports and hand tighten. Now we will begin the steps for competency 2, donning. Donning means to put on your respirator. Start the donning process by positioning the facepiece under your chin and over the bridge of your nose. Next, move the head harness above your ears and across the crown of your head. Now, hook the neck strap below your ears and around your neck. Finally, adjust the straps to a correct fit if needed. Do not allow facial hair, jewelry, or anything to prevent proper seal between your face and the respirator. Let's move into competencies 3 and 4, which will cover user seal checks. It is important that the respirator is tightly sealed to your face to protect you from airborne transmissible infection. To ensure a tight seal, you will learn how to perform both positive and negative pressure user seal checks, which should be done each time you put on your respirator to confirm a safe seal. Now we will begin reviewing competency 3, positive pressure seal checks. For ease of completing this competency, you may want to first locate your exhalation valve and twist it upwards toward your nose. You will now place your thumb or fingers over the exhalation valve opening and exhale for a count of 5 to 10 seconds. Now, when you completed this, did you feel any leaks of air coming out of the respirator? This is usually noticed around the nose or chin when it occurs. Readjust the head straps or device if you did notice leaks. Repeat these steps as needed until leaks are no longer noticed. Now we will move to competency 4, negative pressure seal checks. First, you will want to remove the covers from your filters. Next, you will place the palms of your hands over both filter intakes. Now you should begin inhaling for a count of 5 to 10 seconds until you feel the facepiece collapse. When you inhaled, did you feel the facepiece collapse? If so, you may have a good seal. Readjust the head straps or device if you did not notice the facepiece slightly collapse, as it could mean you did not have a safe seal. Repeat these steps as needed until a slight facepiece collapse is noticed. Let's move into competency 5, doffing. You will start by performing hand hygiene and donning gloves. Next, you will reach behind your neck and unhook the neck strap. Now, without touching the respirator, pull the head harness over your head. Lastly, place the respirator on a surface, such as an absorbent pad, that allows for soiled items. Competency 6. Between patient cleaning and disinfection. We'll begin by preparing our institution-approved disinfection wipes and a clean surface, such as a Chucks pad, to place our respirator on after disinfecting the outside of the device. Next, complete hand hygiene and don gloves. Holding the inside of the respirator, wipe outside of the face piece and head straps with a cleaning and disinfectant wipe. Set the device down on the Chucks pad, and next complete hand hygiene and don new gloves. Finally, wipe the inside of the respirator with a cleaning and disinfectant wipe. Now that we have learned each of the 6 competencies, we will review how to complete a qualitative fit test. All tight-fitting respirators, even disposable N95s, must be fitted initially and annually by employees who use respirators as part of their job. This test confirms that the size respirator you were provided truly fits you safely to ensure best protection. A qualitative fit test involves wearing a see-through hood and eliciting your olfactory senses by spraying sodium saccharin, a sweet-tasting substance. We will replicate the taste threshold test process you completed during the screening process for this study, this time while wearing your elastomeric respirator. We will conduct 7 exercises to test the seal of your respirator during normal activity. During these exercises, you should breathe normally with a slightly open mouth and tongue extension. You will be asked to stand still and complete normal breathing. Stand still and complete deep breathing. Stand still and turn your head from side to side slowly while inhaling at each side. Then to move your head up and down while inhaling each time your head is in the up position. You will be given a paragraph on a piece of paper and asked to read it. You will be asked to bend over at the waist within your personal comfort and safety limitations. And finally, you will be asked again to stand still and complete normal breathing. This concludes our orientation video on reusable elastomeric respirators. We encourage you to ask questions as you work through the steps of wearing and maintaining your reusable elastomeric respirator so that you can be prepared for safe and effective use in a clinical setting. Thank you for your time and participation in this important study sponsored by the CDC. Upon conclusion of this video, the study team will direct you to stations in which you may practice respirator use, followed by assessment to determine the knowledge gained from this video.